Good afternoon, I'm Jules Wechter, and this is Chapman News, the podcast for Friday, April 10th, 2020. A lot of disturbing news, but some glimmers of hope, and we'll introduce you to some people who are making a difference. Let's get started with the day's major headlines. The number of coronavirus cases worldwide crosses 1.6 million, and more than 100,000 have died. And in the U.S., there are over 473,000 cases, the highest in the world, with the death toll of more than 17,800. The U.S. recording the most coronavirus deaths in a single day, with more than 1,800 fatalities on Tuesday. This just days after Surgeon General Jerome Adams warned the nation to brace for our generation's Pearl Harbor moment. But Americans are hopeful, with Dr. Anthony Fauci, the nation's top COVID-19 expert, saying that he is cautiously optimistic about the nation's future. Fauci announcing a new death toll projection at 60,000, contradicting the previous estimate of up to 200,000 deaths. The country is just beginning to see the flattening of the curve, but experts say that doesn't mean things will go back to normal anytime soon. Now, 10% of the U.S. labor force is out of work, and another 6.6 million filing unemployment claims since last week. That is a loss of 16 million jobs in just 3 weeks. New York City is still the major hotspot for the virus in the U.S., and the city's death toll has surpassed the number killed in 9/11. To find out what it's like to be on the front lines at the epicenter of the U.S. outbreak, we have our reporter Jackie Gold in New York with the story. Jackie?
New York City is still the major hotspot for the coronavirus outbreak as the most populous city in the United States. The Big Apple has over 87,000 confirmed cases of COVID-19 and more than 5,000 fatalities. I spoke with the New York Fire Department Lieutenant James Herson to get a first-hand look at how this virus is affecting the concrete jungle and the first responders who keep it safe.
For the firemen in the firehouses now is very tense and a little unknown, I'd say. Everybody has different worries about the virus and if they're going to contract it or bring it home.
Just a few weeks ago, the day-to-day life of the New York City Fire Department looked very different. While the more common calls like car accidents and gas leaks are down because of people staying at home, other emergencies have a new underlying worry. Will this incident get me infected?
It's a run for something totally unrelated to a health issue, where then you find out later that the person's actually coughing too or has a fever, but they didn't call you for that. They called you because, there was a fire in their stove.
The demand for N95 masks is so high that in New York City, James's department can't wear them for every run.
We don't get to pick and choose. We kind of have a department policy that's come down and tells us when we can and can't use it. And then when you do use it, you have to fill out certain forms and document the emergency and why you felt it necessary to use it.
For many frontline workers like James, their biggest challenge is working to protect their city and their families. James explained giving the virus to families is many frontline workers' worst fear.
That's, I would say, the biggest factor weighing down, any frontline worker, nurse, doctor, fireman, police, transit, anybody like that. Their highest value is their family, so that's the last thing they want to do is get them infected.
But nevertheless, James and his coworkers continue to stay vigilant and serve the citizens of New York City.
My job is to motivate the members, keep them safe, but also carry out the mission of the department, which is always, to quote, protect and serve. A couple of laughs around the firehouse at the kitchen table, that always helps. We're always drilling and practicing with our equipment, and that's a good way to keep your mind off of the negative things you can think about the virus and the people you might be exposed to.
For the first time in a long time, the city that never sleeps may be doing just that. But James is hopeful that it is making a difference, and sooner rather than later, they can get back to their normal lives.
Shutting down all of Manhattan is a pretty big deal. I don't know how much more they could do, realistically. I really think that they're doing almost as much as they possibly could within reason and without taking away every civil liberty we have.
All of us at Chapman News thank frontline workers like James for continuing to protect and serve. From Albany, New York, and for Chapman News, this is Jackie Gold.
Thanks, Jackie. From first responders to medical professionals like doctors and nurses, this virus is having major impacts on the medical community. Some new and disturbing trends with the virus, it's now hitting rural America, not just the big cities. And we're finding that African Americans and people of color are more likely to get the virus. We have our Justin Edmondson with our medical report.
Thank you, Jules. As COVID-19 continues to spread rapidly throughout the United States, we now have over 460,000 confirmed cases, and more than 16,000 people have died. Experts are predicting that we will not hit the apex of this virus until April 16th. But New York City, the epicenter of the U.S. outbreak, is expected to reach its peak within the next week. New information showing that 2/3 of rural counties now have confirmed cases of COVID-19. This contradicts earlier expert predictions that the rural residents would be somewhat isolated from this outbreak. Meanwhile, metropolitan areas, such as Chicago, report that the virus is deadlier among people of color. The city is stating that 70% of the deaths were black citizens, who make up 30% of the city's population. Reporter Nina Hatton spoke to our in-house medical expert, Dr. Jerica Lamb, who has answered more of our questions this week.
Good morning, Dr. Lamb. Thank you for coming in today to answer some of our questions. We know that you're busy, so we're going to jump right in. Now, in Chicago and Detroit, we've also seen COVID-19 have a serious impact on people of color, with a disproportionately high death rate in the African American community. Why is this happening?
Yeah, so this is a very good question. We are looking closely at the data and parsing it out from the CDC to really understand what is going on. And according to the Brookings Institute, what they have reported is that relative to Caucasians, the blacks are more likely to live in neighborhoods with a lack of healthy food options, green spaces, recreational facilities, lighting, and safety, and even better air quality. Also, blacks are more likely to live in densely populated areas where they may not have equitable healthcare access, meaning that the nearest hospital may be many miles away from their home, and perhaps the pharmacies and the health network infrastructure are subpar.
New York State now has the most COVID-19 cases in the country, but Governor Andrew Cuomo says less people are coming into the hospital. Why is that?
So it could be, again, just a reflection of the shelter in place in New York, and people are heeding the governor's warnings, and they're managing the symptoms at home, and they're not going to the hospital. And that's a good sign. And we think that perhaps maybe New York is reaching its plateau, and hopefully after this weekend or end of this week, New York would go down on the other side of this incline.
Finally, I'd like to talk about potential treatments. Hydrochloroquine, an anti-malaria drug, is being pushed by the Trump administration despite Dr. Fauci's concerns. Could this drug be effective, and are there any potential dangers?
Yes. So we don't have the evidence to say with 100% confidence that this drug, hydroxychloroquine, is effective against COVID-19. And to address your second question about the potential dangers of hydroxychloroquine, it does have a lot of dangers, and that's why Dr. Fauci and the medical community are emphasizing and reiterating to be cautious with the use of hydroxychloroquine and not to run away with this drug and say it is the cure-it-all of COVID-19.
All right, that wraps up our questions for today. I want to thank you so much for being part of our podcast and for taking the time out of your day to talk to us.
Great. Thank you again for the opportunity.
For Chapman News, this is Nina Hatton.
Masks are a part of our new reality. The CDC now advises everyone to wear masks when going out in public. Flo Singer has all the updates and information on this topic. Flo?
Thanks, Justin. For weeks now, there has been a shortage of medical masks in our country. Medical providers are scrambling, trying to find a solution to this depleting supply. On social media, people are using their time at home to make DIY masks, and some are even selling them. Although a lot of these masks have really cool designs, and I've even seen some with sequins, are they safe? According to the Centers for Disease Control and Prevention, the only mask that will protect people from exposure to COVID-19 is the N95 mask. Many of these homemade sewn masks do not meet the N95 standards, which include respirators that filter at least 95% of airborne particles. However, while homemade masks do not meet the standards of an N95, they can prevent you from infecting other people if you are asymptomatic and don't know if you have the virus. Some people like wearing masks because it's a good reminder for them to not touch their faces while they're out in public places. Reporting for Chapman News in my home in Las Vegas, Nevada, I'm Flo Singer.
Thanks, Flo. New medical professionals across the U.S. are stepping in to help during the dire shortage of healthcare providers. Some starting their residencies early, and some certified nursing assistants being called in to join the fight against COVID-19. Our reporter, Ella Martine, has more on this developing story. Ella?
Thanks, Justin. With the shortages of staff and necessary equipment rising every day, hospitals are calling in their student CNAs and nurses to relieve some of the strain on their certified physicians. I decided to take a closer look into the situation in my home state, Oregon. Oregon has stayed out of the news thanks to the low number of people who have tested positive for the coronavirus. Still, hospitals are overflowing and the state hasn't reached its peak yet. Alex Deeb, a certified nursing assistant at the Providence Medical Center in Portland, was recently notified that he will have to work at the hospital starting next Monday. I spoke with him about his duties and concerns on heading out to the front lines.
The hospitals are super understaffed right now, and we are in dire need of nurses and CNAs who are willing to work. It's just that not a lot of CNAs and nurses are willing to work right now because there is such a shortage of PPE.
PPE stands for Personal Protective Equipment, and its limited availability is causing panic across America. Medical workers and staff don't have enough gear to keep themselves safe in the workplaces, so a lot of them have been using things like makeshift garbage bags to protect themselves. Being thrown into the workforce so quickly was not a part of Deeb's plan. A current nursing student, Deeb trained to be a CNA to get more hours for his school.
It's an extremely hard job for what you get paid for, and I feel really sorry for those who have to work this job and make a full-time living doing this, supplying for their families. It's extremely difficult being a CNA as you're doing all the hands-on work that the nurses don't have time to do. So it's extremely physically demanding. And I just wish there were more recognition for these hardworking healthcare workers.
As the number of cases continue to rise, so does the concern for the stability of a burdened healthcare system and its workers. Those that come in to help receive very little pay for the conditions they work in, posing a serious issue for many workers.
Be done to relieve the stress of workers is double the pay because we are risking our lives.
And as he prepares to go back to work, Deeb is hoping for improved working conditions.
I'm going to be going back to work on the 13th, and I'm going to be working 3 12-hour shifts a week. I'm just most nervous about obviously contracting the virus. But not only that, just being around people who are in a state of stress. And I just really hope the work environment will be okay.
From Portland, Oregon, for Chapman News, I'm Ella Martine. Back to you, Jules.
Exports of personal protective equipment now being seized by U.S. Customs and Border Protection as hospitals across the nation face shortages in vital supplies. FEMA holding the power to determine the redistribution of equipment within the country. Keeping our healthcare workers and professionals safe during this time is extremely important to me, as my own mother is still taking care of sick kids as a pediatric nurse practitioner. She and all her friends are continuing to work and putting their own lives at risk to ensure that their patients have proper care. One of her friends, Christine Schiller, who works as a nurse practitioner in adult urgent care in Hobe Sound, Florida, has seen the virus spread at work. And like many of us, she wonders if taking earlier precautions would have slowed the spread of the virus.
Unfortunately, I was surprised because I'm not an alarmist. I'm a very laid-back kind of healthcare person. So when I first found out that they had it, I was, surprised, and then rethought the whole process because we were not wearing any kind of personal protective equipment. Maybe we should have been a little bit more proactive in protecting ourselves.
Healthcare providers are especially exposed as they continue to work on the front lines. When testing first began, a lot of healthcare professionals were unable to get tested. But when rapid tests became available, Christine was able to get tested and found out that she contracted the virus.
I think if we had done a better job of recognizing people that maybe should have been tested, I had multiple young, healthy people with symptoms, and they were not considered to be qualified for the test. So I think, unfortunately, we probably let about 5 people in our building that probably exposed us, and we shouldn't have.
Luckily, now healthcare professionals like Christine are able to get a rapid test, which can give them their results in just a few hours. However, this still couldn't protect her husband from the highly contagious virus.
Unfortunately, my husband, he was probably exposed, and he seems to be symptomatic today.
Christine warned me that even young people should be wary of the virus. She said that those who smoke are at a disadvantage.
My concern is someone who does, vapes or Juuls or, smokes marijuana, you are compromising your lungs. So, hearing about all of these elderly people dying, you have to remember if your lungs are compromised, if you get this illness, it could turn out to be a very bad thing for you.
Thank you, Christine, for sharing your experience with us. We at Chapman News wish you and your husband a safe recovery. There's still a big controversy over those White House briefings. Many criticize the president for turning them into political rallies. In fact, Vice President Pence is banning CNN's access to members of the task force after CNN refused to carry the entire briefings live. It was a busy week in Washington. With our political report, we have our Michael Karabit. Michael?
The world of politics keeps on spinning, as does the revolving door in the White House. President Trump fired the Inspector General of the Pandemic Response Accountability Committee, which was created to oversee the spending of $2 trillion in stimulus money passed by Congress in response to the coronavirus. The president also swapped his press secretary this week with a 31-year-old Harvard lawyer who has been an outspoken fan of his. Former Press Secretary Stephanie Grisham left her post without having held a single press conference. She will now be the Chief of Staff for the First Lady. And the Secretary of the Navy resigned after he was a little too outspoken when he called the now ousted commander of the USS Theodore Roosevelt, quote, stupid. This following the commander warning of a coronavirus outbreak on board and asking for help. This week also revealed a memo to President Trump dated January 29th warning of a coronavirus outbreak. He claims to have never seen the memo, which warned of a full-blown pandemic in the United States. Nevertheless, Trump is still ranking nicely in the polls, and after Bernie Sanders dropped out of the race for president, Joe Biden has become the presumptive Democratic nominee. In response to the Sanders campaign, the president tweeted his thanks to Elizabeth Warren, saying, quote, if not for her, Bernie would have won almost every state on Super Tuesday. While recent polls predict Biden defeating Trump in the general election, President Trump is polling better than the former vice president in terms of crisis management. But while last week saw a majority of Americans approving of the Trump administration's coronavirus response, that number has flipped as a majority once again disapprove. Biden and Trump spoke over the phone this week, where Biden offered advice to the president from his time during the Ebola outbreak. As the thought of the election lingers, Democrats in Congress are trying to expand voting access in the event that the crisis is still present in November. New voting requirements around social distancing and mail-in ballots will be considered as part of new coronavirus relief legislation. But the president and other Republican leaders have vowed to oppose any such changes, Trump tweeting that mail-in voting, quote, doesn't work out well for Republicans. We'll be back next week to discuss the latest in the world of politics. Until then, wear your masks and wash your hands. From Long Beach, California, I'm Michael Karabit.
Closer to home, the number of COVID-19 cases in California crossed 20,000. And are Californians staying home making an impact? We have Rudy Juarez Pinero with the report. Rudy?
Thanks, Jules. Now, California is beginning to see some progress. New cases statewide curved slightly this week, but it's still too early to tell if we're in the clear. Southern California, the state's epicenter, is facing a number of widespread deaths, whereas the Bay Area continues to see a slowdown, but it isn't enough to lift the shelter in place in time for Easter, as public closures have now extended to roads and neighborhood parks. But as a sign of goodwill in one of the most holiest weeks of the year, Governor Newsom lent 500 ventilators to New York and other states experiencing severe outbreaks. Now, Governor Newsom is uncertain when we will return to a new normalcy, but LAUSD superintendent says normalcy won't be returning anytime soon for the more than 500,000 students in LA. For the past 25 days, Diana Diaz has been helping her little brother Nathan with the transition to online learning. And even though it's second grade work, in the time of the coronavirus, it isn't as elementary as you might think.
How were you feeling when you first learned that your brother's school was going to close?
I was very worried about him because I was like, how are they going to transition? Because they all said, oh, we're going to just move everything to online. And I was like, I don't know how that would work. And then I learned quickly that a lot of it doesn't work.
Nathan's teacher finally figured out how to use Zoom for online learning just last week. It's an improvement from the packets Diana and Nathan worked on, but now they're facing new learning challenges.
Things that I know Zoom offers, like screen sharing and stuff, that I wish, like I think she could do a better job teaching if she knew how to use the right tools. And it's a struggle. So that's why I say, I feel for those teachers. You don't have them right there in front of you.
Nathan is lucky to have a sister by his side, but not every student has a sibling or a parent that could ask for help. On any given day, 40,000 students are unable to keep daily contact with their teachers. Some of Nathan's classmates are among them.
I've heard some of the kids, just mention, I wasn't able to come last time because, I share the computer with everybody else in the house. And then others, they'll have technical difficulties and it'll just completely log them out.
LAUSD says they'll reopen in May, but the governor and state superintendent says schools will remain closed for the rest of the year. Things are kind of up in the air right now, but one thing's for sure. As schools try to adapt, the most vulnerable students, the most in need of help or at risk of dropping out, are falling through the cracks. From Whittier, California, for Chapman News, I'm Rudy Juarez Pinedo.
Thanks, Rudy. And as the Chapman community continues to make adjustments to remote schooling, we have Nina Hatton updating us on how Chapman is staying on top of COVID-19.
Thanks, Jules. Zoom is rapidly becoming an everyday app for Panthers. This week, the company came under fire after a phenomenon known as Zoom bombing took over. Chapman classes were targeted, but since then, the FBI has issued a statement declaring Zoom bombing illegal. And Zoom CEO Eric Yuan has promised to increase security. So hopefully, moving forward, Chapman classes will be safe. With class registration beginning next week, students are voicing concerns about the possibility of classes going remote for summer and fall. The school has yet to give an official statement, and for those graduating, a commencement date is still up in the air. But remember to keep checking your emails. Chapman announcing this week that refund credits may be given for lab and course fees and study abroad. If this applies to you, expect an email with all the refund information. For those in dorm housing, a strict no-guest policy has now been enforced, and students are urged to continue practicing social distancing. Looking to social distance and improve your health? Check out the Rec Portal. They are posting daily 10-minute fitness challenges designed to be done from the comfort of your room. Workouts not your thing? Join Dean Gail Stearns for a weekly calmness practice every Tuesday starting at noon. Stepping outside of Chapman's campus, new changes to the Orange Circle. Fork and Salad has closed its doors, but many businesses are still open for takeout. We spoke with Dan Lesser, a worker at Aussie Bean, about the changes there since quarantine.
It's like a social spot. There's like kids, elderly people. It's like a very family store. So, but kind of once this virus started getting very serious and the schools started closing down, it's just less people come in. Everybody gets it to go. People don't deal with cash, and it's just the vibe is it's kind of on everyone's lips. Everyone's talking about it.
Aussie Bean is making the best of this situation by doing deliveries and being active on their social media, so go check them out. I'm Nina Hatton in Orange County for Chapman News.
Thanks, Nina. And we have a special report from a Chapman News alumna away from home. Alexis Rodriguez dives deep into the situation in Seattle as she covers the news for King 5, the NBC station there. Alexis?
Seattle looks very different these days. A drive through the iconic Capitol Hill neighborhood shows you business after business boarded up. Street artists have created a new kind of graffiti. Beautiful artwork stretched down the streets marking businesses, large and small, deemed non-essential during the coronavirus outbreak. Some businesses, unaware that they may be boarded up for good. It's now been nearly 3 weeks since Washington State Governor Jay Inslee mandated the stay home, stay safe order, forcing people to stay inside if not for essential errands. He recently extended that order through May 4th. Out of the stay-at-home period, we've seen communities working together to save businesses struggling to stay afloat. One association in West Seattle allowing residents to adopt a local shop to donate to during the shutdown. And a map created by the City of Seattle's IT team highlights local restaurants open for takeout and delivery. All a glimmer of hope for business owners just trying to keep from sinking. Out on the roads, there are less cars but more people in the streets just on foot or on bike now. There's an overall feeling of calm, especially on days the city's typical gray skies turn blue. Calm despite the more than 400 deaths and more than 9,000 confirmed cases in Washington state, all on a week expected to be the peak of all cases in the state. But the state appears to be winning its fight against the virus. The University of Washington Medicine has been leading the battle since the start of the outbreak. New this week, UW Medicine is recruiting 25,000 people across the country, all for a coronavirus outbreak prediction app. The study will track a volunteer's symptoms over the next 2 years. Local hospitals are also working on equipment to sanitize used masks during a massive shortage of personal protective equipment across the country. Back outside the hospitals, Governor Inslee says our efforts to flatten the curve are working. Schools are now shut down through the rest of the school year. Most people are working from home and wearing masks in public. As a rainless forecast looms in the week ahead and the supposed peak of coronavirus cases nearly behind us, the Puget Sound communities await word on their progress. Reporting from Seattle, Washington, Alexis Rodriguez with King 5 News, reporting for Chapman News.
Thanks, Alexis. Turning our gaze globally, major headlines out of the UK this week. The number of coronavirus cases worldwide crosses 1.6 million and more than 98,000 have died. We have Jada Sandhu with the story and today's major global headlines. Jada?
British Prime Minister Boris Johnson has now been released from the ICU. He was taken to the hospital after testing positive and showing persistent signs of the coronavirus, and was moved into the ICU on Monday after his symptoms worsened. An increasing number of cases and deaths in Spain, just a week after the country saw a decline in fatalities. And with the death toll reaching over 10,000 in France, Paris has now put a ban on outdoor daytime exercise from 10 a.m. to 7 p.m. Prime Minister of Canada Justin Trudeau saying things will not be back to normal for a while as the lockdown continues for weeks to come. And this seems to be true for other countries too. Argentina, El Salvador, South Africa, Spain, and Finland have extended their lockdowns. Japan has officially declared a state of emergency that will last until May 6th. And Hungary has extended its restrictions indefinitely. Egypt is keeping mosques closed and suspending all Ramadan activities. Wuhan, China, where COVID-19 was first reported, had its first day with no new deaths relating to the coronavirus since January, and its 76-day lockdown has been lifted. Saudi Arabia has declared a 2-week ceasefire in Yemen to halt the spread of the virus. The UN hopes this will give them a chance to hold a meeting between the two parties and reach an agreement for permanent ceasefire. Now, everyone is trying to get their hands on masks, but a man in London took things a little too far. He is now facing 3 months of jail time for stealing 3 surgical masks from a hospital. World Health Day was this week, and Disney parks around the world participated by writing messages of thanks for healthcare teams who are continuing to help during the pandemic. And social distancing isn't stopping 6-year-old Kira Neely from making memories with her grandfather. Living across the street from each other, this duo has social distancing dance parties on opposite sides of the road to keep their bond stronger than ever. For Chapman News from Peoria, Arizona, I'm Jada Sandhu.
Thanks, Jada. With unemployment rates continuing to skyrocket, many Americans are worrying about making ends meet. Our Anna Montemore has been keeping an eye on the economy for us this week and is here with our economics update. Anna?
Thanks, Jules. This country has lost 16 million jobs in just 3 weeks. The United States economy is facing uncharted territories. Just how are things changing? Over a 3-week stretch, almost 17 million Americans have filed for unemployment, the highest levels since the Great Depression, according to the U.S. Bureau of Statistics. The hardest hit are those in the hospitality and food industries. But now declines are also occurring in healthcare and social assistance, professional and business services, as well as construction and retail trade. Amazon, one of the big four technology companies, along with Google, Microsoft, and Apple, faced more employee strikes this week. This is now the second labor protest against Amazon. Unsafe working conditions, as well as the inability to unionize, is what's driving these protesters. Amazon has released a statement saying, like all businesses grappling with the ongoing coronavirus pandemic, we are working hard to keep our employees safe while serving communities and also the most vulnerable. Last week, Trump signed the largest stimulus bill in history, a one-time payment into your bank account on top of what other unemployment checks you already qualify for. It is uncertain at this time when Americans will see the stimulus package in full effect. Trump says he is hoping to have Americans receive the payment early April, but specialists say it doesn't seem likely. On Wednesday, Wells Fargo announced that they will temporarily lift their lending cap as a way of issuing more loans to small businesses in need of it. Joining the other auto companies in the production of ventilators, electric vehicle company Tesla announced Monday that they will begin using their car parts to create new ventilators to help combat the virus. The engineering director, Joe Mardell, explains just how they are aiming to do this.
As Lars said, we've been working on developing our own ventilator design, specifically one that's heavily based on Tesla car parts. We want to use parts that we know really well, we know the reliability of, and we can go really fast, and they're available in volume.
Tesla has not yet stated when this design will be done and the production of the ventilators will begin. For Chapman News from Seattle, Washington, I'm Anna Montemore.
Thanks, Anna. And while we continue to social distance and stay home, this is a great time to catch up with some new content. We have Kim Becker with the latest in quarantainment this week.
Hi everybody, Kim Becker here with your updates in entertainment for the week. As we are still hunkered down in our homes, celebrities around the globe are getting together to help keep us sane and entertained. Easter Sunday is this weekend, and Andrea Bocelli has announced he will be singing live from the Duomo Cathedral in Milano, Italy at 10 a.m. Pacific Time. The concert is called Bocelli, Music for Hope, and it can be viewed on his YouTube page. A philanthropist is born, with Lady Gaga raising $35 million in only 7 days for the World Health Organization's COVID-19 Response Solidarity Fund. Gaga is partnering with the WHO and Global Citizen to launch a virtual music festival called One World Together at Home. We'll have a chance to spend some time with our favorite artists, including John Legend, Lizzo, and Billie Eilish on Saturday, April 18th. The broadcast will be hosted by Jimmy Kimmel, Jimmy Fallon, and Stephen Colbert. You can sign up for the party on globalcitizen.org. And I know this is the week all you Coachella goers should have been prepping those snazzy outfits for the gram, but you can still get a taste of the desert by heading over to YouTube when you're done listening to this podcast to check out the Coachella documentary that dropped today. The film, titled Coachella 20 Years in the Desert, features never-before-seen footage, interviews, and performances from some of the hottest names in music. And if you're sitting there thinking, okay, seriously, I just need the real-life Coachella, hang in there, folks. Just a few more months till the rescheduled dates of October 9th and October 16th. But that's enough about music. What about TV and movies? The highly anticipated streaming app Quibi is finally available. The app launched this week, giving users a taste of what the future of streaming might look like with super short movie-quality episodes ready to watch on your iPhone. It sounds like we'll have more than enough content to stream, even with production on pause, and all I can say is thank goodness for the arts and entertainment during this crazy time. In Orange County, this is Kim Becker with your quarantainment for the week. And now on to the happenings in the world of sports. We have Brad Benson with the latest.
Just 2 months after his death, Kobe Bryant was selected to the Basketball Hall of Fame. During his 20 years with the Lakers, Kobe won 5 championships, picking up 2 Finals MVPs, was selected to 18 All-Star games where he was named MVP 4 times. He won the dunk contest, led the league in scoring twice, was named to the All-NBA team 15 times and won league MVP in 2008. However, his wife Vanessa says that going into the Hall is Kobe's greatest accomplishment.
It's an incredible accomplishment and honor, and we're extremely proud of him. Obviously, we wish that he was here with us to celebrate, but it's definitely the peak of his NBA career, and every accomplishment that he had as an athlete was a stepping stone to be here.
The NFL offseason is kind of going on like it normally would. The initial wave of free agency came and went, and the draft is still happening, just virtually. Teams will not be allowed to have war rooms, and announcers will be broadcasting from home. There will also be a virtual spin on one of the most iconic moments in the draft, as EA Sports announced that the top prospects will be able to choose how they want their Madden player to greet Commissioner Goodell on the stage. The NFL also announced that the 3-day event will be a virtual fundraiser, or draft-a-thon, to help battle the spread of COVID-19. Reporting from Anaheim, this is Brad Benson for Chapman News.
Thanks, Brad. We like to end our show every week with Spot of Hope, people who are making a difference. This week, our Flow singer has 2 stories of heroes who have not let this pandemic stop them from helping those in need. Take it away, Flo.
Last week, we spoke about heroes who are on the front lines of the pandemic every day. Since then, the heroism has not stopped. This week's hero of the week is Chef Jose Andres, a 5-star restaurateur and founder of the charity organization World Central Kitchen. Although his restaurants are closed until further notice, 8 of his locations in Washington, D.C. and New York City are serving takeout orders for just $7 per meal. With so many people out of work and families struggling to make ends meet, Andre says that anyone who cannot afford to pay are still welcome to a gourmet meal. Chef Andres founded World Central Kitchen in 2010 to help relieve the hunger of those in need.
We want to change the world through the power of food. I do believe that phrase, more than ever today, has a big meaning. We can all change the world through the power of food. In this case, we need to bunker down. In this moment, we need to be thinking that even if we've been busy this weekend, that actually closing down is the best thing to do to make sure that this virus will go away sooner rather than later.
The organization already serving over 1 million meals to communities and first responders in over 30 cities nationally and across Spain since the start of the pandemic. And an unlikely hero from Colorado is helping an elderly neighbor. 71-year-old Renee Hellman has been stuck alone in isolation with underlying health concerns that keep her from going out to get her own food. Wanting to help while maintaining a safe social distance, Karen Eveleth taught her golden retriever Sunny to deliver food to Hellman's door. While Eveleth prepares the bowls of food, Sunny then drops them off next door, later bringing back the empty bowls once Hellman is finished.
Things like Sunny coming over to visit is nice, and it makes you feel good, and it's a way of communicating.
Hellman calls Sunny her humble hero as he continues to brighten her days in isolation. Reporting for Chapman News in my home in Las Vegas, Nevada, I'm Flo Singer.
Well, that was the cutest thing I've ever heard, and that's it for our report today. Make sure to practice social distancing, wash your hands regularly, and most importantly, stay home and keep safe. We'll get through this together. We'll be back next week with another update on the ongoing crisis. Until then, be sure to check out our social media at Chapman News on Instagram and Facebook. I'm Jules Rector in Jensen Beach, Florida for Chapman News. Stay safe and healthy.